Welcome back, guys, to another roundtable discussion for the JPS Education Portal. You're here with myself, Martin, and our special guest today, Anthony Viglione of the Movement Institute. Welcome, guys. So today we are discussing preventing injuries, and Anthony is more than qualified to discuss this. He is the in-house injury prevention expert at JPS. So Anthony, tell the guys and listeners a little bit about yourself and obviously your background, your qualifications, and everything in between.
All right, so I am a APA titled physiotherapist here in Melbourne. I work down at JPS, have now for the past year. I run or co-director of the Movement Institute, and my background, I previously have competed twice in bodybuilding, with my actual bodybuilding debut being my last season, with my first season and both last season primarily in Physique. I have also got experience working in powerlifting and a few other sports, both team and individual based sports.
Yes, and I just recently found out that you were once a hooper, Anthony. So
Yes, yeah.
that is great news. We'll have to sign you up to the JPS bricklayers at some stage. So clearly you're somebody who has the experience lifting, training, and working with people who lift and train. So when it comes to preventing injury, I guess what are some of the key reasons why people get injured in the first place in resistance and barbell related sports?
I think given the nature of the sports that we're dealing with people who are pretty much trying to push the limits of what the body can physiologically do. So when the demand is sort of exceeded, so when the demand that we're placing on the body has exceeded that body's capacity or that person's capacity, that's where an injury may occur. It may not actually occur, but there is always that potential for it to occur. And when we get to that point, there is structures that will break down. So whether it's muscle, bone, joints, ligaments, all of those structures have the potential to break down when we're pushing those upper limits of what we can actually physiologically do. Really commonly in bodybuilding, because of the barbell-based sports and the loads that we're placing on the body, usually tendons and muscles are the ones that tend to break down first.
Awesome. So I guess, do you want to elaborate a little bit further on what this actually looks like in practice? So when we talk about the demands that we're placing on the body, what are the variables that we're seeing that people are pushing that exceed the system or the tissue's capacity to tolerate those demands? Obviously we know that people are pushing load, but it isn't just load that's always the cause of, or load in the traditional sense that people are going to infer that as weight on the bar, because we know that external load sort of is an all-encompassing term for more than just weight on the bar. It's the amount of stress imposed on the tissue or the joint, and that is influenced by more than just weight on the bar.
Yeah. So with load being one of the main driving factors for these sorts of things, the volume, the intensity, and then the total accumulated fatigue over time that's generated throughout that the prep are also factors that can contribute to why someone gets injured. If we're thinking, for example, like a squat, most people during a bodybuilding prep are going to be doing a 1RM squat. Again, like that's a really, really high load. Some people can tolerate it and not get injured, but it generates a lot of systemic fatigue. Now, if we're dealing with people who are doing large rep ranges, that accumulated fatigue intraset in that actual set versus over a period of time, over a mesocycle, will can ultimately lead to more fatigue over time. Now, if you're looking at an individual set and if you're pushing to that upper limit, you're getting to your RPE 9, RPE 10, or RR, you're pushing that person to the limit that they can reach within that set. And if certain structures aren't strong enough to tolerate those loads. So, for example, if we're talking a squat, axially, you've got the spine that's involved and the trunk stabilizers, but then also the quads. Now, if your trunk isn't able to tolerate that load or that volume of work that you're doing in that one set, but your quads can keep going, you might find that the back gives way first, even though the quads can keep going. And
Yeah.
that's where an injury might occur because the back has not been able to sustain the load or the work that you've asked it to do, even though the quads are still able to keep working.
Yeah, and I think that's a very common issue with most lifters is that the prime movers are able to tolerate a lot more than the stabilizers in most cases, especially on a lot of exercises that have a high degree of axial loading, things like squats and deadlifts. You see people, start to round their back on a deadlift, and it's not necessarily their quads that can't, initiate the movement and produce the force required to get the bar, to hip and knee extension. It's the lower backs and the lumbar's ability to stabilize. So you mentioned a couple of things there that I want to touch on further. So cumulative fatigue and how that impacts, obviously, injury risk and things like that. Marto, this is probably an area that you can chime in on. I know that you've done some work on, how proximity to failure influences fatigue and things like that. So is there anything that you want to add to the discussion?
Well, yeah, I think one thing that we need to consider is, as you alluded to earlier, Jacob, we have external load, which you described as an all-encompassing term for the stress that is being imposed on the body. But then we also have this internal load, this idea that, there is also stress coming from factors that might be related to our sleep, our nutrition status, and just our general life, right? The stress that comes along with our general life. So cumulative fatigue from our training, that's going to feed into the external load, right? So over time, training is going to, it's hard enough, it's going to impose fatigue that might accumulate. And we need to consider this in terms or relative to the internal load that we're also exposing our bodies to over time as well. So something to consider is, well, if the internal load is quite high, if maybe we're not sleeping that well, we're quite stressed, nutrition maybe isn't as good as it could be, the cumulative fatigue that we experience from training might then come with a slightly greater injury risk. And this means we might need to pull our training load back or decrease that external load whilst we improve other factors like our sleep, our nutrition, our stress. Because there's a lot going on here, and injury risk is obviously quite complex, and we can't just think of it as being the external load. Obviously, there are times where our body might be able to take a lot of fatigue, and cumulative fatigue might not be as much of an issue if our internal load is low and we're sleeping well, we're not as stressed, we're eating well. So I think considering how those two go hand in hand is really important over time when you're thinking about the effects of cumulative fatigue, because cumulative fatigue might not be all that bad if you're able to buffer it with low stress levels, good nutrition, good sleep, etc. So something to consider there.
Yeah, that's a really good point. I think there's two things there that worth reiterating is that yes, we can't just look at external load and the training stress in a vacuum and not consider the neurophysiological backdrop that we're placing this stress into, right? So that is the internal load. And also the second point there is that the management of load, to the biological system, does vary over different timescales, whether it's seconds, minutes, hours, days, weeks, months, and also to varying magnitudes, right? So these things have to be considered when it comes to obviously managing and preventing injury. So with all of this said, Anthony, when it comes to load management in the gym, you'd think it's a rather simple thing, right? Because it's such a controlled environment compared to other sports where you have uneven surfaces, you've got sports that aren't necessarily self-paced, they're dynamic in nature, adjusting to the conditions and varying context that an athlete might be in during a game, for example, when compared to barbell-based sports or resistance training is such a, I guess, predictable and easy to manage, load compared to other areas. So what do you think is the best way, for people practically and pragmatically to manage their load and things to look out for to prevent injuries? Because we know that, acute spikes in workload are usually what causes injury risk to go up to some degree, although it's not always load, itself per se. But, how do you suggest that people start thinking about this in terms of managing injuries in the gym, like as it relates to load management?
Yeah. Well, I think I'll go back to almost like what happened with myself with my most recent bodybuilding contest prep. And I think it starts from the very beginning before you're choosing to actually enter into that prep. And if we're talking a contest prep, it's like assessing like your current situation, like what your lifestyle is like outside of that before you start actually going down that process and knowing, okay, like the analogy that I got taught back at uni, and this is more just from like injuries, is like your cup. It's like knowing how much is in your cup before you start spilling over. And if you're adding a lot into that, whether it's the training that you're doing, and there's already everything external that's already in there, and that cup's already full. If you start adding more and more intense training, you're going to keep spilling over. And if we're talking like with a training cycle, it's like you can have a training block go for 6, 7, 8 weeks and be absolutely fine and not need or require a deload. But you can have training blocks where someone will get to week 4 and they're absolutely fried because everything outside of that, or the actual factors that are impacting on their ability to recover, are hitting them a lot sooner than what someone else doing a similar or same in volume of work is exposed to. But they're just purely because of the external factors, they're able to recover and adapt in a more efficient way.
Yeah, I totally agree with that. And I think, well, would you agree that that comes down to poor program design? If somebody is forced to deload every, say, 4 weeks, let's say the goal is hypertrophy, I'm certainly of the opinion, if that's the case, that they're probably not, the prescription of training is probably too great for that person to be able to manage, in an appropriate way, and you need to adjust things, right? But I guess, yeah, there's always, context to be considered there. But when it comes to how we actually measure and manage load in the gym, I know that you do this with a lot of your athletes that you work with, in soccer and things like that.
Yeah.
How do you recommend that people look at managing load in terms of preventing injury?
I think consistency is probably the biggest thing, and looking at it, like we obviously program throughout a microcycle. So some people will grow a week, some people will have a slightly different structure, but looking at what you're trying to achieve across that week, and then also looking at the volumes that you're achieving across each of the muscle groups, and then ensuring that someone is able to realistically recover from that over that week, and that you're not creating excessive spikes week to week.
No.
Because over a consistent training week, like if you're able to fully adapt to that, you throughout that week, the next week you would expect that with small adjustments, whether it's an extra set or extra reps or an adjustment in load, you would still be able to adapt to that. But if you're making absurd adjustments in those training variables, or multiple adjustments across those, where you're creating large degrees of change from week to week, there will be a reduced ability to adapt to that. So,
Yeah.
for example, you're doing 5 sets total volume for your quads in 1 week, and then you suddenly jump up to 10 sets with the same loads, same sets and reps in the next week. There's a risk there because you've doubled the total volume, and the magnitude is quite high.
Yeah, I like that.
Versus a small adjustment.
I think you certainly need to, because you can come at that from 2 ways. Because obviously people are very gung ho in the gym, right? They want to make progress, they want to build muscle, get stronger, add weight to the bar, and progressively overload, right? But that requires them to meet an overload threshold, sure. But you don't want to go so far above that threshold that you're no longer able to recover and adapt, right? So it's finding that balance. And as you mentioned, I think, yeah, consistency is key so that you can assess, am I recovering, and observe trends, if you do get injured so that you can identify when things might be too high or recovery is poor, and you might need to adjust it. And I think that's a really good point. Like the stress needs to be within like your adaptive proclivity, right? Otherwise it's just going to be too much. So Martin, I guess in practice, what are some things that you're trying to do when you're progressing your clients' training over the course of a mesocycle to prevent these things?
Yeah, I think a lot of this also comes down to subjective feedback from the client. So if I'm thinking about some of the clients that I tend to push really hard in the gym, and I think about what I do with them, well, firstly, I'm having regular conversations with them about the factors I mentioned earlier that relate to their internal load, because I think that's massive. I know that I'm writing a program for them that they can tolerate, and I know that the only way I'm going to be able to push them harder is if they're ticking boxes outside of the gym. So if they are ticking those boxes and they're doing so on a weekly basis and they're obviously keeping me up to date with that, I'm going to be more inclined to push them harder in the gym. And I guess the next step from there would be making sure that every additional step that I take with the program, whether that be the addition of an extra set or pushing slightly closer to failure or adding an intensity technique, making sure that that next step doesn't come with a large consequence or recovery burden post training. So if they're able to tolerate it pretty well, and they don't seem to subjectively mention that they're feeling less recovered than they previously were after that training session, after that increase in volume, whatever it might be, I'm going to be happy with that. That's a thumbs up. And I generally don't tend to do that on a weekly basis. I don't think it's overly necessary to do on a week to week basis. Once a client is acclimatized to a given training stimulus, we can hang out there for a while. They can push hard as long as they're ticking boxes outside of the gym. Again, thumbs up. And when the time is right, we can then take the next step. Again, whether that be adding more volume in certain muscle groups that we want to bring up if the goal is hypertrophy, pushing closer to failure, whatever it might be. So there's many levers that you can pull, whether that be proximity to failure, volume, subtle changes in the way you might execute an exercise. And over time, you as a coach, you want to think of ways that you can make training somewhat harder for the client without changing too much in the program. And I think there's many different ways you can go about doing that as long as those other boxes are being ticked outside of the gym as well. I think when it comes to just injuries, just generally, Anthony, I'm interested in your thoughts on like how we would, as coaches or as trainees, how we would classify an injury, because a lot of us will experience some pain in the gym, whatever that might be, whatever magnitude that might be. And where do we draw the line between just pain and an actual injury? Because a lot of people, I think language is really important when it comes to this sort of thing. I think a lot of people will be training and will feel some level of pain and will say that they're injured. But how can we truly know that's an injury? Because this directly relates to Jacob's question. I might be pushing a client pretty hard and they might come to me and say, well, I felt a little bit of pain in this area. There's several questions that I then ask as a follow-up to work out whether or not it's something I should actually be concerned about or not. Because in some cases, I might actually not need to be concerned about some pain that my client might subjectively be experiencing. And that's because tissue damage isn't directly related to pain, or pain isn't directly proportionate to tissue damage. So just because someone's experiencing pain doesn't mean there is damage that we should be concerned about as coaches, or at least highly concerned about. So how do you go about thinking about, how do you go about thinking about pain and injuries and trying to kind of separate the two?
Yeah. Well, I guess if you want to talk like pain versus injury, like we all experience like, well, to some degree, we will experience DOMS after, an exercise or a training session. And some people would class that as quite painful. Now, have you done damage or have you caused an injury? No. Well, we've caused damage, but it's a level that we can tolerate quite well. We can still function. We can still do everything. Yes, there is soreness, but it doesn't stop us from doing things. And I think that's where the difference between like an injury or a niggle or pain sort of that line needs to be drawn. It's like, if you're injured, then there is a clear loss of function. And whether that is, the magnitude of that loss of function is going to be individual and it's going to be determined based on the injury itself. But if you're feeling pain or discomfort in an area, yes, you've probably had a very acute amount of stress or load placed through that area, which is why you might feel that. But that doesn't necessarily mean that you've caused an injury, because you could wake up the next day and it's completely resolved.
Anthony, sorry, just on that quick question. So,
Yeah.
I noticed a lot of clients, to your point there about, the loss of function whilst experiencing pain, under conditions where arousal is low, their function is a lot less than what it would be if arousal was high.
Yeah.
Right. And I think, I'd be curious as to your thoughts there, because a lot of people, especially if they're not very accustomed to delayed onset muscle soreness and the pain that comes with, hard training, they would report that, oh, I can't do this movement because of my quads and therefore I'm injured, I've lost function. When in fact, it's just that soreness is preventing or inhibiting them from moving in the way they normally would. But if they were aroused enough or they had enough adrenaline, and somebody said, hey, if you can squat 100 kilos, then I'll give you $1 million, I guarantee that they'd be able to fucking do it. How do you tease that out with certain people?
It's great. I usually use I think that would come down to a more practitioner sort of approach, and the way in which you develop that relationship with the client and the ability to build confidence and build trust with them, so that they almost trust you a bit more to get them to what you want them to do and or what you're trying to get them to achieve. For example, this is probably a different way to look at it, but if you're asking someone to do a squat and it looks like it's all over the place, but then you ask them to sit down in the chair, they can probably sit down in the chair pretty well. When you're trying to do, like, build someone's confidence up to do movements or expose them to loads that they haven't been exposed to before, or do things that they think they're fearful of, it's building them up. I find that building them up to that by finding less fearful or less apprehensive movements.
So it's graded exposure. It's graded exposure to more fearful or apprehensive movements. Okay.
Apprehensive movements. So gradually exposing them up to things that they are, not confident with, and building them up to that. So if we're talking,
does that classify as a loss of function? So would you say that they're injured if they are fearful of doing a certain movement?
No.
Yeah.
If, because of a previous injury, it's like, I've had a number of clients that say, I don't want to do deadlifts anymore because that was how I hurt my back last time.
Yeah. That's right.
I had a client who, 2 years ago had never set foot in the gym, and now she's training 3 times a week, doing, and is confidently moving in the gym. But that took like a long time to build her up to that level, and that was purely just because she had, a really, really bad previous experience with an injury. And we call it, like, you've got type sensitization. So you've got central sensitization and then peripheral. That sensitization is sort of like similar to what we experience, and as individuals, if we're fearful of a certain thing, it will mean that we're more reluctant and more resistant to that changing and being more comfortable actually doing that. So trying to gradually, again, like graded exposure, gradually reduce that sensitization and that fear around movements or training is probably one of the more effective ways of getting someone back into the position that we need them to be in to be able to continue to progress.
And just to clarify for listeners, this is when somebody isn't necessarily injured, but
No,
they have a fear of returning to whatever movement caused the level of pain that they're now
exactly.
concerned about. Okay,
Yes.
that's awesome, and I think that's very
Yeah.
useful because this is what we as coaches deal with a lot is people who experience an amount of pain or discomfort that they're not used to, or that causes some fear and apprehension. Say they've done some RDLs. I know every coach listening to this would have experienced this at some point in their career. They get a client to do a set of RDLs, and the client comes back the next day and says, "Oh, my lower back's sore. I can't come in to train." Well, it's like, no, your erectors were just stabilizing your spine, doing their job, and you've just got some DOMs there, and you're not used to that. That's a very different situation to somebody who's, say, strained a muscle, or has
Exactly.
a facet related injury, from deadlifting and things like that.
Yeah. And I think with that, as well as like that, being able to identify the difference between that loss of function comes down to the actual assessment of that person. It's like if you're looking at them and you can, say, passively move them through a range of motion, whether it's you get them on the floor doing some mobility exercises, bringing their knee to their chest comfortably, going through full range on both sides. If none of that is different or none of that's changed, and there's just a true like fear of that movement because I've hurt myself, that's where you can sort of make that clear identification of
Yeah.
that's an injury versus that's, fear and apprehension of that movement.
Yeah, and in that situation, the approach is to get them to move in low threshold, situations where things aren't as fearful, and they then gradually expose them to more and more stress, essentially. So,
Yeah.
in the case that somebody does have an injury, obviously this is outside the scope of most PTs, but I think it's worth discussing. When somebody is injured, what are the ways that you manage that, or recommend coaches to help you manage that with their clients? So if somebody's returning to train, they've lost function, in a certain movement, they can't do it. What are some things that coaches can do besides obviously heed to the advice of, a registered healthcare practitioner? What's your approach there in terms of getting people back to training through the rehab process, and coaches' role in that?
Yeah. Well, I guess first of all, it depends on where the person or the athlete or client has come in. If they've come into you and they've injured themselves externally, the first thing that probably needs to be done is get as much information and understanding of what's happened so that you know how to then manage that person. Because if you don't know what's happened, you don't know how they've injured themselves, and you don't know what their level of function is at now compared to what it was, it makes it really hard to then make decisions on what you can do moving forward. Um, Gaining an understanding of what their aggravating, factors are and easing factors are, and understanding the movement patterns that they're going through when they're causing those aggravating factors and easing factors can help guide your decision making when it comes to modifying your training program. For example, if someone is more painful moving into extension, or more pain, or in more pain when they're flexing their hip to a deep level, we can modify movements to help avoid or help reduce the stress that's placed on those structures when we're actually loading them up.
Yeah. So
Finding
things like reducing range of motion, obviously decreasing load, volume and things like that, to just make it more tolerable and ensure that you're not doing further damage, I guess
Yeah,
is the message there. And I
yeah,
think as you would recommend, most people just need to encourage their clients to train around the injury,
yeah.
right? Like how often do you have people completely stop exercising or training if they've hurt, a muscle or a joint? Is that something that's quite common, with your clientele?
Yeah, like I very rarely, and there are a number of cases where do have to rest a person for a period of time because their inflammatory response is too high, or just the nature of the injury itself. It's like if you've broken something, there's like no loading that's going to be
Besides a
beneficial.
break, what are some other examples where complete rest would be advised?
So when I say complete rest, it's not necessarily complete. I think pretty much complete rest is out of the question, because there's always other things that you can be working on. So if you've done something to your leg, for example, like if we're talking like tendinopathy versus, and I'm going to botch this one up, encephalopathy, you've got the injury that's occurred at the muscle tendon junction, and then the injury that's occurred at the tendon and bone junction. Now, if you've got tearing at the tendon bone junction, you're not going to be loading that up because the risk of making that worse is really, really high.
Yeah.
So, but if you've got a tendinopathy, you can still load that up. You know, heavy isometrics are probably one of the best things that you can do for someone who's dealing with a tendon-related injury.
Yeah.
But even in the case where you do have to rest that particular joint, there's still so many other movements and so many other exercises for the rest of the body that you can still be doing. So it's knowing how to navigate that person's injury. And that's where obviously, if as a PT or as a coach, if you don't have that knowledge to identify the difference between an injury that needs to be rested and an injury that can still be worked through, working with the information that you have, these movements hurt, these movements don't. Let's do the ones that don't, and let's just work around this until we know more.
Yeah. Yeah. And that's so common. Like I've had that multiple times this week. Like I had one client who, she's seeing you guys, hurt her neck, and she's like, "Oh, I can't train today." She's an older woman, and I said, "What do you mean? Come in, we can train some legs." She's like, "Oh, okay." Like people don't even think about that. Sometimes the acute pain response is so great that people just feel like they can't do anything at all. And another example, literally just today, one of my clients fell downstairs. And she's a high-level basketball player. She's like, "Oh, I've got to rest." And I'm like, "Well, can you walk?" And she's like, "Yeah." I said, "Well, why don't we do some light, movement? We'll do some upper body, push our session from Tuesday to Thursday." And she's like, "Oh yeah, good idea." Like people, their first point of call when they experience pain is to rest. And, I guess what's some advice that you have to encourage people? Like, what do you say to your clients, when they do have that kind of mindset and they're very apprehensive to move again? Like, how do you approach it? What are some tips that you've learned in the trenches over the years?
My go-to response is just keep moving. Like if you stop, if you become stagnant, the likelihood of you declining further is what is higher than if you just keep moving. Find the things that feel comfortable, find the things that allow you to keep doing what you want to be doing, because by stopping, it means that you then have to work even harder to get back to full function.
Yeah. No, I like that, Marlo. And what about you? What are some of the things that, because I know that you've worked a lot, in your research on like discomfort and understanding the difference between discomfort and things like, muscular failure and whatnot. Like what are some of the words that you use with your clients to help them just better understand, I guess, some of the experiences they have when it comes to pain, discomfort, injuries, and things like that?
Yeah, I think the more I learn about how the biopsychosocial model influences pain, the more I start to think that our
You manipulate
language
people.
with
You manipulate
clients
people.
is important.
Admit it. I
I
know where you're
mean,
going with this.
it's not manipulation, but it's being smart about the words that you choose to use when a client encounters pain. So, for example, like you alluded to it earlier, Jacob. People often think that rest is the first thing to do, and that's because they kind of catastrophize the pain to some extent. And catastrophizing pain is actually associated with like more pain, even if the tissue damage is actually quite low in whatever area the client or the person is feeling pain in. So one thing you can do as a coach that I think is super underrated is just encourage the client to continue moving, like you said, and just help them be more positive about whatever it is they're experiencing. Because even the emotional response to any given pain can either, if it's a negative emotional response, that can worsen the pain. If it's a positive response, it can help alleviate it. So there's a lot going on here that you as a coach can to some extent manipulate with your words. And I think that can be very important long term when you are working with a client who might be somewhat, prone to experiencing pain on certain exercises, whatever it might be. Maybe they have a higher sensitivity to discomfort, which is definitely a thing. So across, all my clients, I can tell you the ones who have a high sensitivity to discomfort, and other people who have quite a low sensitivity and can push quite hard in their training, and they don't really respond the same way to pain as other people might do. So some clients are just going to need more encouragement. They're going to need more support from you as a coach. And what makes it hard sometimes is, a client might come to me and say that they're feeling, pain in a certain area, and I know it's probably nothing major. I'm trying to be positive about it, but then other people start telling the client that it's something that they should really, really be worried about, or that this is really bad. It's your back. Maybe you shouldn't deadlift. So sometimes the external lack of support from people can hinder what you're trying to do as a coach, with your encouragement, with your language, and trying to navigate that is what I've found hard in the past. And the last thing I'll say is ensuring that the client is trying to actively cope with the pain, I think, is important. What I mean by this is actively trying to do something about it. So I've had clients in the past who will experience pain and who might not really bring it up. So they're kind of passively coping with it. They're just not really doing anything about it. And not only is that associated with like worse pain outcomes long term, it's just not good for anyone. It's not good for the client's long-term health, and for you as a coach, it's going to hinder your ability to help them. So encouraging them to see a physio, to get on top of whatever it is they're experiencing, again, as a coach is critical. So if you don't have the skill set to help with whatever it is, it's in your best interest to refer them on, get them seeing someone ASAP so that they can get onto it and they can actively cope with it. I think how you cope with pain, I'm sure you'd agree, Anthony, is important. People cope differently, and as a coach, you have to navigate that and obviously help the client cope in the right way, and ensure that you get on top of things as quick as possible.
Yeah. Like that's probably perfect. Like that's literally been put perfectly, because the way that I would sort of describe it to people is like, to take control of their narrative, take control of the story that they're trying to tell themselves. It's like, if they're just, accepting the fact that, they're injured and that's it stops them from actually taking those steps forward. But by taking control, whether it's,
Yep.
trialing out some mobility exercises, doing small things in the gym, or going and seeing a physio or even their doctor, to take
Yep.
those active health movements forward, is going to be more beneficial than just accepting the fact that they've hurt themselves.
Yeah. So there needs to be some level of optimism, which I
Yeah,
think is important. It's not a matter of being solely optimistic, because sometimes there is, some damage
no,
that might take quite some time to recover.
exactly.
But I think on average, being a little bit more optimistic is likely going to help some people. And
Yeah,
again, some clients are going to be more inclined to be kind of down in the dumps versus
yeah,
others. And those are the ones where, as a coach, your language and the way you support them emotionally is really important. And
absolutely.
I've noticed that to be a game changer. Learning more about how this whole biopsychosocial model can feed into the
Your
way you
manipulation
coach a
strategy.
client. Yes, manipulation
Yes.
strategies.
Um, no, I
Uh,
totally agree, Marto. And I think I would say that a healthy dose of pragmatism and optimism is usually the best medicine for, I guess, encouraging people to move through
Hmm.
pain and injuries, because you do have to be pragmatic, not just to being aware of like their situation, the context that you're dealing with. If there's somebody who is hypersensitive and, a little bit pessimistic when it comes to training, you need to be pragmatic and work with what you have there. But then you need to inject that optimism if you're the coach. And in the same vein, you might have somebody who's super optimistic and not very pragmatic, and you need to inject the pragmatism into their plan, because they're just gonna be like, yeah, I can still do all these things. It's like, well, we'll
Yeah.
slow,
Yeah.
right? So the role of the coach is to understand, okay, which do we need more or less of here, based on this client. and, you know, assess accordingly. So I think, you know, there's lots of really cool points there, and we've covered, yeah, quite a lot in terms of managing injuries. Is there anything else you guys want to discuss before we wrap up this chat? That's it, Anthony. After all your years of, like, you know, 6, 7 years of study in the field, that's all you got to say.
You
That's it.
That's all I'm gonna say. Nah, I think when it comes to like managing injuries, like it's important. Probably the biggest thing is ensuring that the relationship between the coach, the client, and anyone else that's involved in
Yeah.
their end goal is as coherent as possible, and everyone's on the same page of what we're trying to achieve. And that's probably one thing, again, just by working within, JPS at this space, being able to be on the gym floor and ensure that, everyone that's involved in, getting that person to where they want to go is helping with that journey as well.
Yeah. Awesome. Awesome. Well, Anthony, thank you so much for joining us today. Marto, thank you for your time as well. Guys, if you haven't already, make sure that you check out the Movement Institute on socials. The guys are fantastic. And if you ever need someone to give you advice on your injuries, pain, or rehab process, be sure to get in touch. Until next time, we'll see you all then.
Thanks for having me, guys.